So, if you've ever had back pain, I'm willing to bet you've heard this one before, right? Maybe a friend said it, or a family member, or maybe you've even said it to yourself. And, it's usually meant to be comforting, but man, it can feel so dismissive. So let's dive into this, because there is a much bigger and honestly a way more hopeful story to tell here.
Okay, first things first, and this is probably the most important thing I'm going to say. Let's just get this right out in the open. Your pain is real. It's not just anything. And it is definitely not something you just have to accept as a fact of life. Period. And you know what else? You are absolutely not alone. I mean, not even close. Just look at this number. Right now, there are 619 million people around the world living with chronic low back pain. That's just a staggering figure, and it really tells you this is a shared human experience. And to put that number into perspective, chronic low back pain is the #1 cause of disability in the entire world. That's more than heart disease, more than cancer. So we're not talking about some minor ache here. This is a huge global health issue. Okay, so a huge part of the fear that comes with this diagnosis, it comes down to one single word: chronic. It just sounds so heavy, doesn't it? It sounds permanent. So let's do this. Let's break down what that word actually means.
Yeah, this really gets to the heart of it, doesn't it? Over on the left, that's what chronic sounds like. It feels like a life sentence, permanent, hopeless. But look at the right. That's the actual medical truth. It's just a time classification. All it means is that the pain has lasted for 3 months or more. It's describing how long it's been there, not how long it's going to be there. Big difference.
You can even think of it like stages on a timeline. See, you've got acute pain, then subacute, and then chronic. It's just the third stop on the line. It's a category, not a final verdict. And this is the crucial part. Improvement is absolutely 100% possible in this stage.
So you might be thinking, okay, if it can get better, then why does it feel so stuck? And the answer is, well, it's complicated. But here's the thing. Understanding that complexity is the very first step toward feeling like you have some control again.
Check this out. In about 85% of cases, doctors can't point to one single smoking gun. There's no one definitive cause. Now, let me be super clear. That does not mean the pain is imaginary. It just means it's complex. I mean, think about it. Your lower back has discs, joints, muscles, nerves. It's a whole system. And usually a few of those things are contributing all at once. It's not that there's no cause. It's that there are multiple causes working together.
Okay, here's another one, a phrase that can just strike fear into your heart. You get an MRI, you get the report, and you see words like this. But how much do those scary sounding findings actually have to do with the pain you're feeling?
Now, this might be one of the most important things we're going to talk about. A major study looked at the MRIs of people who had zero back pain, none, and what they found was wild. By age 80, a staggering 96% of them had disc degeneration. So what we call abnormalities on an MRI, they're often just normal signs of aging. Think of them like gray hair or wrinkles, just on the inside.
And then there's the whole mind-body connection, which is huge. It can turn into this really vicious cycle. See, it starts with pain. That pain makes you afraid to move. And that fear, well, it leads to you being less active, which makes your muscles weaker. Weaker muscles can't support you as well, which, you guessed it, leads to more pain. And all of that fuels stress and terrible sleep, which just ramps up the pain signals even more. It just feeds itself. And I want to be absolutely crystal clear about this. When we talk about psychological factors like stress playing a role, we are not saying the pain is all in your head. Not at all. Your pain is 100% real. It's generated by real nerve signals. But things like stress, anxiety, and not sleeping well have been scientifically proven to turn up the volume on those real pain signals. Okay, so we've kind of torn down some of the big myths and fears. Now for the most important part, right? What actually works? Let's get to the good news.
This right here, this is the gold standard of evidence. It's called the Cochrane review. Basically, they took a look at 249 different studies, which included over 24,000 patients. I mean, that's massive. And their conclusion? It was completely unambiguous. Exercise is effective for chronic low back pain, and they said that with high certainty. But here's where it gets really interesting and even more powerful. The research doesn't just say, hey, go do any exercise. No. It shows that when you specifically match the exercise to your unique pain pattern, the results are way better than just some generic one-size-fits-all program. So what does that even mean, pain-matched exercise? Well, it's pretty simple, actually. For example, if bending forward is what triggers your pain, maybe exercises that involve a gentle arch or extension are the way to go. If arching your back is the problem, then flexion exercises might be your friend. And hey, if there's no clear trigger at all, general core stabilization is often a fantastic place to start. The whole point is finding what works for your body.
Right. Let's start to bring all of this together. Let's talk about what the path forward looks like, not just for you, but for your family and the people who care about you too.
And if you happen to be watching this for a loved one, please know that your understanding is one of the most powerful tools they have. You can help by creating a safe space where they can be totally honest about what they're feeling. Try to avoid those little dismissive phrases like, it's just aging, and maybe learn about this stuff with them. When you do that, you're not just a supporter on the sidelines anymore. You become a real partner in their recovery. So as we start to wrap up, let's just quickly go over the most important things to remember. Number 1, you are not alone. There are over 600 million people right there with you. Number 2, chronic does not mean permanent. It's a timeline, not a life sentence. And number 3, the stuff you see on an MRI, so often it's just normal aging, not the actual cause of the pain. And then, number 4, the right kind of exercise works. The science is incredibly clear on that. And number 5, which might just be the most important one of all, please do not suffer in silence. Reaching out, getting help, and taking that first step, it can absolutely change your future. So that leaves us with just one final, really crucial question. This isn't about finding some magic overnight cure. It's about progress. It's about moving forward. And understanding your pain is that first huge step. So what's the first step you can take on your path forward?